long-term care in Missouri, okay? So long-term care in Missouri. In Missouri, like I said, every state kind of runs their program a little bit different, okay? In Missouri, long-term care has 4 levels, only 4. 4 levels, and 4 levels are all here in this slide, okay? From the highest to the lowest, it is called skilled nursing facility SNF and intermediate care facility ICF. And then 2 lower levels, that's called assisted living facilities and residential care facilities, RCF, okay? So SNF, ICF, ALF, and RCF, those are 4 levels of care in Missouri. Outside of this, anything that you think it might be long-term care, let's say group homes for younger adults that have drug issues, they go in to do rehab, right? So let's say teenagers, that kind of group homes, transitional housing. So let's say drug rehab programs, because sometimes drug rehab programs it could be for years. You can stay there for years, right? Let's say correctional housing. Let's say ladies abuse shelter, okay, domestic violence abuse shelter. We have those things here too, right? None of that is considered long-term care. In some states, actually, they consider prison as long-term care. Okay, and guess, do we consider prison as long-term care? No. Okay, we're in Missouri. Okay, and when I talk about that, some other states some of them they actually include a prison in long-term care, and then usually when I talk about that, my audience would say to me that well, I'd rather just go to a prison. Yeah, I don't want to be in a nursing home. Well, let's not be that extreme. Now, did you see? Between intermediate care and assisted living, I put down 2 words. What are those? 5 minutes. Yes, 5 minutes. Okay. Yes, and that is how we decide: do you qualify to be in an assisted living, or you actually have to go to a higher level, such as a nursing home? Okay, and I will talk about that in a bit. But let's start with the lowest level of care. That's residential care facilities, RCF. Okay, for some reason I forgot to put RCF there. You can put it down there for me. Okay, RCF. Okay, residential care facilities. In Missouri, it is designed for people that are younger, and by younger, we are talking about younger than 65, and usually we are looking at probably around 55 or so. But then you're asking, well, if someone is 55 or even younger than that, why are they in a long-term care facility like a residential care? Well, because they have mental or physical disabilities. Okay, and then they also might have a drug rehab problem. Okay, they need to be there to do their drug treatment. Okay, that kind of facility, RCF, is designed for younger population in Missouri. Okay, now, so one thing though, for Missouri, a lot of these RCFs, they receive DMH funding, and that stands for Department of Mental Health, DMH funding. Okay, so when a facility, when an RCF receives DMH funding, they are not allowed to accept registered sex offenders. Okay, so but if a facility does not receive DMH fundings, it's okay for them to accept registered sex offenders. Okay, That said, let me clarify for you. The federal guidance for long-term care facilities, there is more than 900 pages. If I tell you that I memorized all 900 pages, do you believe me? I don't believe me either. So over 900 pages of long-term care guidance, federal guidance, and Missouri's it's only probably 400 or 500 pages, which mirror the federal guidance. Okay, so we always go for federal guidance. So federal guidance over 900 pages. They don't mention a word about registered sex offenders. In other words, all different levels of care, they are allowed to accept sex offenders. Okay, all different levels. So in other words, federal government doesn't have a problem if you want to take in sex offenders. Can you, as a facility, can you decide that, well, we want to make a policy that we do not accept the sex offenders? Yes, you can. You certainly can. Okay, that might be one thing that you want to ask when you visit a long-term care facility. Okay, now for the RCFs, residential care facilities, as long as they receive DMH funding, they are not allowed to accept sex offenders, and that is just the guidance, the policy in Missouri. Okay, now say we are looking for a long-term care facility for someone that is older, right? And say someone that is in their 80s, in their 90s. We are probably not going to start with residential care. We will start at the ALF level, assisted living level. Okay, so assisted level ALFs in Missouri, there is also assisted living level 1, assisted living level 2. Those level 1 or level 2, they don't make much difference to us. So don't worry about it. Okay, this is just a piece of information as an FYI for you. Okay, so level 2 can take people who need a little bit more care. That is what level 2 means. Okay, but that doesn't mean a thing to us. We don't have to worry about that. So, well, two things. One, assisted living in Missouri, 99% are private pay. We are talking about between $4,000 and $8,000 a month. Okay, so 99% are private pay. Some facilities, some assisted living, they might consider sliding scales. Okay, what is sliding scales? Well, you have more money, therefore you pay more. And then the other person, they have less money, they pay less. That is called sliding scales. Okay, some facilities, they would say, well, we take Medicaid. Okay, some facilities. That is on one condition, though. What is that? That is that, well, we want you to come in first to sign a contract to be our private pay resident for, say, at least 3 years, 5 years. Okay? Once your assets, once your money is getting low and you can no longer afford, which has to be at least three years with us, and then we will transition you to Medicaid, and then we will keep you here. Okay, that is what that is, the assisted living accepting Medicaid. Okay, and then don't worry about the Medicaid, Medicare. We will talk about that. Okay, now, so usually in Missouri, the aging process that we hope for is like this. Okay, you have worked, you have saved for your entire life, right? And then you got some money, you got some you got a house, you got whatever, you got assets. And then as you are aging, as you are in need of long-term care, then well, you might start with in-home care, right? And then after a while, then maybe in-home care, a few hours a day, a few days a week, that might not be enough anymore. What is might not be enough anymore? Meaning there is safety issue, there's liability issues here. Okay, and I will explain. So then when that happens, then what? Then we graduate from our own house. Then we move on to an assisted living, right? So when we go to an assisted living, I said between 4,000 and 8,000 a month. Let's say 5,000 a month. Okay, 5,000 a month, 5,000 a month, 5,000 a month. How many 5,000 a month can you afford? Right? So Missouri's idea is that, well, hopefully when you are spending down to a certain point, and what that certain point is 5,000. Okay? When you are going all the way down to you have only about $5,000 worth of assets, then you qualify to have Medicaid. And then by that time, when you qualify to have Medicaid, what's going to happen? You might be frail enough to graduate from assisted living, which is lower level of care. And then you might move on to higher level of care, which is skilled nursing. Okay? Now, before I get to skilled nursing, I'm going to talk about that 5 minute here. Okay? What is that 5 minute? That means that, well, if you can do this 5 minute thing, then you might be able to qualify to move into an assisted living and pay that $5,000 a month. Isn't that great? So okay. What is the 5 minute? Here's the thing. I want to make sure. Okay. What is the 5 minute? So 2 o'clock in the morning, 2 o'clock at night. Okay. Grandmom's sound asleep in bed. And then there is a nurse come knock on the door saying that, hey, grandmom, there's a fire in the building. We need to get out. You need to get out right now. Okay? Grandmom then has to get up by herself because why? Because this nurse has moved on to the next door to knock on the door to tell people to get up, to get out. So grandmom has to get up herself and then get dressed, get her glasses on, put on her shoes, maybe grab her walker, and navigate herself out of the room. And now grandmom is on the second floor, hopefully, okay? Grandmom is on the second floor. Can you take the elevator? No, because there's a fire. You have to take the stairs. And then grandmom takes the stairs all the way down to the first floor, the ground floor, and now getting out of the building, right? So from the moment that the nurse is knocking on the grandmom's door to the moment that grandmom is actually outside the building, how many minutes do we allow? Yes, thank you, 5 minutes. Okay? If grandmom can do all of those within 5 minutes with minimum assistance. What is minimum assistance in Missouri? That means verbal assistance. Okay? Grandmom, get out. Get out of the building right now. Grandmom, this way. No, don't take the elevator. Take the stairs. That is minimum assistance. When grandmom can do that, then within 5 minutes to get out of the building, then that means grandmom qualifies to be in an assisted living. And grandmom qualifies to pay that $4,000 to $8,000 a month to live there. Okay. So if that's not the case, then grandmom cannot do that, because assisted living actually requires their residents to have semi ability to be semi-independent. Okay? If grandmom cannot do that, then what do? You have to go to higher level of care. Okay? And then there is SNF, skilled nursing facilities, and ICF, intermediate care facilities. And that doesn't really make a whole lot of difference to us. They are almost same levels of care. The reason I listed them there here, because that is how the state licensures are. Okay, but it doesn't make any difference to us, so don't worry about that. Just know that they are considered a higher level of care. That's it. Okay, when grandmom can no longer do assisted living, that means grandmom just has to go to higher level of